right.
Okay. One of the most popular things that we hear with the patient rights a lot of times, which is not an uncommon situation, I experienced it myself with my daughter, is when being in the hospital and they're all of a sudden telling you you're going to be discharged and you're not ready or you don't feel that you're ready. So that's a very common situation that occurs. Calling statewide senior action, we can guide you, we can provide information to what the process is as far as being able to be listened to. We also offer programs like managed care counseling and assistance program that is helping seniors try to make a more informed decisions on their Medicare Advantage plans, especially now that we're coming up against open enrollment. One of our biggest programs too is the Senior Medicare Patrol. What we do with the Senior Medicare Patrol is we try to empower and assist Medicare beneficiaries and their families and their caregivers to prevent, detect, and report Medicare fraud. Medicare fraud, it spends every year, there's billions of dollars spent in Medicare fraud. So it's very important that as a member, a Medicare beneficiaries, you're able to try to protect yourself against the Medicare fraud. So that's just another program that we offer, and we're available to assist you with that. So with that said, what we're going to be going into is the Medicare portion of this presentation. First of all, what is Medicare, or who is eligible for Medicare? But most importantly, to understand that Medicare is a federal health insurance that's offered to seniors. You have to be eligible to be in Medicare. You have to be 65 years older. You have to be a citizen of the United States or a legal resident for more than 5 years in order to be eligible to enroll in Medicare. You also eligible for Medicare if you're not 65 but have been disabled for at least 24 months or receiving your SSI or retirement, railroad retirement disability payments. Essentially, you're disabled for 24 months. You're actually going to be automatically enrolled in Medicare. You also are eligible for Medicare if you have end-stage renal disease or the Lou Gehrig disease. Now, once you're eligible for Medicare, most people are going to be going into Medicare when they turn 65. And this is called their initial enrollment period because this is the first time that they're eligible to enroll in Medicare. The initial enrollment period happens to be a 7-month window that begins 3 months prior to the month that you're turning 65, the month of your 65th birthday, and follows 3 months after. So that 7-month period is called your initial enrollment period. Anyone, if you enroll during the 3 months preceding your birthday month, Medicare will start the first of your birthday month. So even if you happen to be born on the 30th of the month, if you enroll in Medicare, your effective date in Medicare will be the first of your birthday month. The exception to that, however, with everything, there is an exception, is that if you happen to be if you happen to be born on the first of the month, that is your birthday, then your Medicare will actually begin the first of the previous month. So that makes your initial enrollment period, let's say, for example, you're born the 1st of July, your initial enrollment period actually will begin March, April, and May. Those are the first 3 months. That's the period that you would enroll in Medicare, and your effective date would actually be June 1st to go on Medicare. Enrollment in Medicare and Medicare Part A and Part B must be done through Social Security. So for the most part, if you happen not to be collecting your Social Security benefits, then it is up to you to contact Social Security to enroll in your Medicare Part A and B. And this can actually be done whether it's you can call over the phone, you can call and set up an appointment to enroll over the phone, or you can actually enroll online. So it is up to you to initiate your enrollment into Medicare unless you are collecting your Social Security benefits before you turn 65, then in reality, that step is going to be taken for you. They're going to automatically enroll you into Medicare. If you're collecting your Social Security benefits prior to turning 65, you don't have to do anything. It's going to be automatically, and you're going to receive your Medicare card about 3 months prior to your 65th birthday. Now, once you enroll in Medicare, you know, Medicare is broken down into parts. Part A is your hospitalization. Part B is your medical. And we're going to talk about the different parts of Medicare. So let's start with Part A, which is your hospitalization. For most people, the Part A is at no premium. There's no cost to enroll in Medicare Part A, your hospitalization. And the reason that there would be no cost, as long as you've worked 40 quarters in your lifetime, paid into the system about 10 years, you're going to get the Medicare Part A at no cost. However, if you just happen to be slightly under the 40 quarters, there would be a monthly cost for you. For an example, if you only have 30 to 39 quarters, you're looking at $270, $74 per month for your Part A benefits. And if you're under the 30 quarters, you're looking at $499 per month, which is a pretty hefty premium for Part A. But again, most people are going to be premium free because they've worked enough quarters during the years to enable them getting the Part A at no additional cost. Part A, the hospital portion, also has a deductible. And a deductible is an amount that you have to meet first before your benefits are picked up. Part A deductible for 2022 is $1,556. And for it actually going to be going up slightly for 2023, it's going to be going up to $1,600, the Part A deductible in 2023. But the important thing to know about this deductible, it is not an annual deductible. It is a benefit period, and it's a 60-day benefit period for your Part A. And I'm going to talk about that or explain that a little bit more in the next slide. What is a benefit period under Medicare, original Medicare Part A? A benefit period begins the day that you're actually admitted into the hospital. And this benefit period ends when you have not received any hospital or skilled nursing services for 60 days in a row. So let me give you an example. You get admitted into the hospital. It's the month of February. Let's say you get admitted into the hospital. You're in there 3, 4, 5 days, however long you're in there, and then you get discharged. At that point, the clock essentially starts clicking. And what happens is that if you happen to be admitted prior to 60 days of no further treatment, then you're still, if you get readmitted, whether it's for the same reason, a different reason, even a different hospital, but you get readmitted within that 60 days, you do not have to meet that Part A deductible again, because you're in that 60-day benefit period. However, 61 days, 62 days, you go beyond the 60 days, guess what? When you go back into the hospital for whatever reason, you are now going to be responsible for an additional Part A deductible. So that is different than most of the standard deductibles that we're hearing about, which is their annual. This is 60-day benefit period. And that's a very big distinction when you're talking about Medicare Part A deductibles. Part B of Medicare is what covers the medical, which is essentially everything outside of an inpatient status or hospice or anything like that. You're talking about everything that is your doctor's visits, your labs, your x-rays, your mental health, ambulances, everything else is going to be covered under the Part B portion of your Medicare. Under the Part B premium, there is a premium. So you don't pay for your Part A, your hospital, as long as you've worked enough quarters. But regardless, when you sign up for original Medicare, there is going to be a cost for the Part B premium. In 2022, most people are paying $170.10 for their Part B premiums. The Part B premiums is automatically deducted from your Social Security benefits, railroad retirement, or Office of Personnel Management if you happen to be retired from the state or the federal government. But it will be, if you're receiving those benefits, it's automatically deducted from those benefits. If you do not receive these benefits, you will be billed quarterly for the Part B premium. Keep in mind that most people will be paying this standard amount of $170 for 2022. The exception would be, as you see at the bottom here in red, if you happen to be a person whose income level, if you're a single person and your income level exceeded 91,000 as a single or 182,000 as a married couple, when you enroll in Medicare for the first time, they're actually going to look back 2 years. And if your income is above those amounts, you will be charged what they call a surcharge. And depending on where your income falls is going to determine the amount that you're going to be paying, which is going to be higher than the standard amount of $170.10. So keep in mind that if they look back 2 years, if you were assessed a surcharge because your income was higher, and as you obviously you probably were working 2 years ago and now you're retired, you do have the ability to ask for a reconsideration on those amounts. For 2023, the good news is that the Part B premium is going to be going down, and the amount is going to be going down to $164.90. So that's something to be excited about, that the premium is actually going to be going down. Part B, deductibles and coinsurances. So just like Part A, where I told you that there's a hospital and that covers your hospital benefits and there's a hospital deductible, there's also a separate deductible for the Part B medical portion. Now, it's a much lower deductible and it works in a different way because it is an annual deductible, like most of us are used to. So the annual deductible in 2022 for Part B is $233. And essentially what that means is that if you're going on for the beginning of the year, you go to your doctor's office, the first $233 is going to be out of your pocket. Once you satisfy that annual deductible under your Part B, everything else that's going to be covered under your Part B is Medicare now going to cover you at 80%, but it's always going to leave you paying 20% coinsurance. So as you can see, when you're talking about Medicare Part A and Part B, they're still out-of-pocket costs. You got deductibles that are going to be coming out of your pockets, and then you have your 20% coinsurance with original Medicare. Part B, penalties. If you happen not to sign up for your Part B portion, most people when they turn 65, even if they're still working, will actually pick up their Part A because it's at no cost to them. Puts them into the Medicare system, they get an ID card with a Medicare ID. But then for some reason, some people may not feel that they want to sign up for Part B or feel that they don't have the need for it. However, if they don't sign up for Part B when they should have, which is usually when they first become eligible for Medicare, they would be subject to a Part B penalty. And that penalty is 10% based on whatever the Part B premium is that year, 10% for every 12 months that you go without Part B. So essentially, every year that you go without it, you're going to be assessed a 10% penalty. So if you go 2 years without picking up your Part B when you should have, then you would essentially be charged 20% higher. That's your penalty is going to be tacked on to whatever the Part B premium. And that is a lifetime penalty. So, and it's a cumulative. So therefore it's, we strongly encourage you, if you're not sure that if you need to pick up your Part B, do call StateWide, because we can, based on your situation, determine, no, you're okay, this is why you're okay, or no, you need to pick up your Part B. You want to avoid these penalties at all costs. The other part of Medicare that is very important for you to understand is the Medicare Part D, the drug coverage of Medicare. Medicare Part D coverage helps pay for your prescription drugs. It is offered to you by private companies, meaning that you are not going to enroll in your Part D when you enroll in your Medicare Part A and B, because you have to go to a private company to pick up your drug coverage. This is optional. And it is optional and it's offered to everyone with Medicare. However, they say it's optional, but if you don't pick it up when you first become eligible for Medicare and you pick up your A and B, and this has happened quite a few times where people say, well, I'm not picking up my drug coverage now because I'm not taking any medications. The reality is that if you don't pick it up when you first become eligible, guess what? You are also subject to a late enrollment period penalty for not picking up the drug coverage. And we'll talk about what that penalty is in the next slide. You must join a Medicare approved plan that offers drug coverage. So in other words, that you're going to deal with a company that has been approved by Medicare to offer you a Part D plan. Each plan is going to vary in cost and have their own list of covered drugs. So in other words, whether you go to a private company and pick up a standalone drug plan, regardless of what company you're going to, the premiums can be different and the drug formulary can be different. So part of your shopping around should you be and make sure that the drugs that you're taking are actually going to be on that particular Part D company's drug formulary. And prescribers must be enrolled in Medicare to ensure Part D coverage for that prescription. Essentially, what that means is obviously your doctor has to be participating in Medicare in order to write you a prescription to be covered under your Medicare Part D. Now, the Part D enrollment penalty is different than the Part B, because remember, the Part B is 10% for every 12 months that you go without the Part B. But under Part D, the penalty is actually 1% times the number of months that you failed to enroll in a Medicare Advantage plan. So essentially, if you're a person that went without drug coverage for 2 years, as an example, 24 months, you would be assessed a 1% times the number of months. So 24 months, you're looking at 20% higher premium based on the national average premium, which in 2022 is $33.37. So just to give you a good example, if you went 2 years and it was based on 2022's 33, you're looking at 1% is 33 cents per month. You multiply by that by 12, you're probably looking at about $7.92 penalty on top of your Part D premium. So again, what we try to make sure is that people are aware that, you know, what they need to get on a timely basis to avoid any possible penalties. Nobody wants to pay more than they have to, believe you me. You may owe a late enrollment penalty at any time after your initial enrollment period if you go a full 63 days without coverage. So that's kind of like a grace period for you. But once you go over those 63 days, then that clock's going to start ticking and you're going to be assessed a penalty. The national based premium may change from each year, so your penalty amount will also change. And that's the important thing, is that it's based on what the national base premium is. So as that premium goes up and your percentage is based on that premium, your penalty is going to go up. So very important that you avoid any penalties for your drug coverage. Now, what I want to be able to do in this slide is, especially for those that may be new to Medicare or even people that are on Medicare, to have a better understanding of how their Part D plan actually works. Because believe you me, it is different than anything else you've had before, whether it was through an employer group or a marketplace prescription drug plan. Medicare Part D's drug plan works differently than any other. And to give you some sort of idea, any Part D plan that you enroll in, regardless of what company you choose, it is set up the same way. There's 4 different stages of coverage in a Medicare Part D. And this chart right here kind of like, breaks it down for you. The first stage of a Medicare Part D could be a deductible. Not all plans have a deductible stage, okay? But if the plan that you selected has a deductible and you have to meet it, you're going to stay in stage 1 until you satisfy that deductible before you move to the second level. Again, not all Part D plans have a deductible. So if your plan does not have a deductible, then you automatically move to stage 2. Stage 2 is what they call the initial coverage period. And this is a stage where you start paying your co-payments or your co-insurance on your particular medication. In the initial coverage, your medication is going to either be in tier 1, 2, 3, 4. The higher the tier, the higher the cost of that medication. So part of making sure that your Part D plan is covering your drug and it's on that formulary, you also want to know what tier that medication is in so that you have a better understanding of what that cost to you is going to be when you go to the pharmacy. Is it a co-payment? Is it a co-insurance? That's going to happen in the initial coverage section. A person will remain in stage 2 or the initial coverage level until their total out-of-pocket cost reaches $4,430. Now, again, that is the total cost of the medication. That's not necessarily the copayment that you're paying at the pharmacy. When your total cost reaches $4,430, now you're going to be advanced to the third level, which is called coverage gap. For those of you, if you've been in Medicare for a while, you might remember the term donut hole, the infamous donut hole. That is essentially the coverage gap, and you will be pushed into the coverage gap once your total out-of-pocket reaches $4,330. The good news is that as of 2020, that gap has been closed. So now it is what happens when you reach that third level is that automatically you're going to be paying 25% of your generic brands, 25% of your name brands, depending on your medication. That could be an increase from what you were paying before, or it could be a decrease. But this is the third level, the coverage gap. You will remain in the third level until your out-of-pocket cost reaches $7,050. Again, when that amount reaches that $7,000, then you're automatically going to be pushed out of the third stage into the fourth and final stage, which is called the catastrophic coverage phase. Now, essentially, this stage here is intended to save you additional money. So you're going to be, your savings is going to be greater in the catastrophic level. However, keep in mind, you've been on either a lot of medications or expensive medications to even get to that fourth and final level. So the break that you're going to get is that now the cost of your medications are going to be 5% or $3.95 generic or $9.85 brand name, whichever is greater. And this is the fourth and final level. So my purpose for explaining this is to make sure that you have a good understanding, especially if you're coming off a group plan, going on to Medicare, that you really understand that this is going to work differently than anything you've had before. If you're a person that has low prescription drug coverage, you may not go through any of all of these different stages. But if you do have expensive medications, that's a person that's going to be going through all these different levels of coverage. Keep in mind that people don't have to keep track of where they are. I know this is a lot of numbers and a lot of if your number hits this, you're going to move on. But every Medicare person is going to get a statement every month from whatever company they enrolled in, letting them know how close they're getting to the coverage gap. So they'll have a good indication of where they are within all of these stages. Now, I've just explained to you Medicare Part A, Part B, and Part D. So with this screenshot that I'm showing you here, I really want to give you a really good idea of what your options are when you're new to Medicare, and maybe not necessarily new to Medicare, but even a person who's been on Medicare for a while that's coming into the open enrollment. These are your options. This is a visual of how you can understand how what choices you have in order to access your Medicare benefits. There's two ways here. I'm going to refer to them as option 1 and option 2. On the left-hand side where it says original Medicare, I'll refer to that as option 1. So whether you're new to Medicare or whether you're coming up on your open enrollment, you are able to decide, well, how am I going to access my Medicare benefits, for example, for 2023? And original Medicare, again, is Medicare Part A and Part B. If you decide, well, I'm going to stay with original Medicare, that simply means that Medicare is going to be administrating your benefits. You're going to go to doctors that participate with Medicare, and you're going to present your Medicare red, white, and blue ID card to that provider. That provider is going to bill Medicare directly. Medicare is going to apply your deductibles and your coinsurances. So we have original Medicare that's administered by Medicare, and that's the route that you chose. So in order to cover your out-of-pocket costs, such as your deductibles and your 20%, if you glance down in the yellow box, see where it says supplemental coverage or Medigap plan. Although this is optional, I would strongly recommend someone who's going to stay with original Medicare to consider a Medigap plan because, again, as I indicated, there's a lot of out-of-pocket costs and you're trying to protect yourself against financial medical exposure if you don't have a Medigap plan. Medigap plans are offered to you by private companies, and there's like 10 different plans that you can enroll in. And to give you some sort of idea of what that cost would be, you're probably looking at in this area somewhere around starting at $200 a month on up. I've seen them $200, $300, $400 for a supplemental Medigap plan. Keep in mind that if you're going with original Medicare, remember, you're paying your Part B premium. That's never going to go away. Now you're going to a separate company to pick up your Medigap plan for maybe possibly an additional $200 a month. On top of that, if you look up in the lavender box where it says Part D, remember, if you don't pick up your Part D, you're subject to a penalty. So you want to make sure that you do go to a separate private company and pick up and purchase a Part D prescription drug plan to avoid any penalties. So when you're looking at option 1 on the left side of this chart, I kind of like to refer to this as you're getting your Medicare cafeteria style or a la carte, right? You're getting your A and B directly from Medicare, then you're getting your Part D from a private drug plan, and then you're getting your Medigap from another company. So you're getting everything, all these multiple parts from different sources. There's nothing wrong with that. It just tends to be a little bit more costly. There's more paperwork, but the positive part of that is that if you go with original Medicare, you have access to any doctor in the United States that participates with Medicare. You're going to be able to see that doctor. Medicare is going to pay first. Your supplement is going to supplement the covered services by Medicare, and you just have a wider network of doctors that you can participate with. So that's one option that you have. Second option on the right-hand side of your screen, you're going to see where it says Medicare Advantage Plan. That's another way of accessing your Medicare benefits. Again, you have to have and be enrolled in Medicare A and B to join a Medicare Advantage plan. But those Medicare Advantage plans, regardless of what company you're choosing, will generally include your Part D drug coverage. So technically, advantage number 1 is when you go with a Medicare Advantage plan, that company is lumping in all the different parts of Medicare, your A, B, and D, and you're accessing it from one company rather than the other option of a la carte. And generally, you're going to be, could possibly be looking at one additional monthly premium above and beyond the Part B premium. That, remember, whether you go with option 1 or option 2, you're always going to be paying that Part B premium. The Medicare Advantage plans, every company is going to offer you at least one of their plans is going to be at 0. So you can potentially enroll in a Medicare Advantage plan, get your Part A, your hospital, your Part B, your medical, and your drug coverage at no additional cost above and beyond the Part B premium that you're already paying. However, they may offer different Medicare Advantage plans that have an additional premium. So essentially what I wanted to do by showing you this chart is just having a better understanding of the 2 different ways that you can access your Medicare benefits. Keep in mind, with open enrollment, I really think that a chart like this really kind of helps have a better understanding of all this mail that you're receiving from all these different companies. You're going to be able to kind of decipher what exactly they're actually offering you just by the term that they're using. If they're saying that they're offering you a Medigap plan, then that's to be used strictly with original Medicare, if that's the way that you want to go. If they're using the term Medicare Advantage plan, those Medicare Advantage plans will be administrating your benefits. So you can have a better idea as to what you want to focus with those when you're looking through that mail. So a little bit more information on the supplemental plans. As I indicated, that they are sold by private companies. And if you have a Medigap plan, it pays for part or all of certain remaining costs of original Medicare. Okay. Medigap plans are also covered health costs that Medicare does not cover at all, such as foreign travel, because Medicare is only for the national. So if you are a person that likes to travel overseas, you may want to consider a supplemental plan that has the travel benefit attached to it. Down below where it says choosing a Medigap plan, there's about 10 different Medigap plans that you can select, and they call them Plan A, Plan B, Plan C, not to be confused with Part A or Part B of original Medicare. They are called Plan A or Plan B or Plan G. Those are supplemental plans. Important to understand that when you're shopping around for a supplemental plan, if you're looking at a company and they're offering you Plan G at a certain cost, and you're looking at another company, that Plan G is the same Plan G regardless of what company you're looking at. But the benefits don't change, but what can be different from one company to other is the premium. So it kind of gives you some peace of mind that when you are shopping around, Plan G, plan, whatever plan it is, it's the same plan regardless of who you go to. A little more information on the Medicare Advantage plan, which is option 2 on the right side of that chart. Medicare Advantage plans are referred to as Part C. So remember, we talked about A and B and D. And anytime you see any reference to Part C, they're talking about your option 2, your Medicare Advantage plan. Keep in mind that if you choose a Medicare Advantage plan or Part C, also known as an MA plan, you're never going to see that on your Medicare card. Okay, it's in the Medicare system that you have Part C. And again, Part C is a Medicare Advantage plan. I reiterated that you must have both Part A and Part B to be enrolled in a Medicare Advantage plan, and that most Medicare Advantage plans will offer you the drug coverage included in that Medicare Advantage plan. But be careful when you're shopping around, because most Medicare Advantage plan will offer at least one plan that may not include the drug coverage. And if you're not careful, you want to make sure that when you're choosing a plan, it clearly indicates includes Part D, your drug coverage. So again, you don't get assessed with any type of penalty because you accidentally dropped it. when you enroll in a particular plan. Medicare Advantage plan, in many cases, the biggest difference with a Medicare Advantage plan is that now you're dealing with a network of doctors, and you're dealing with a service area. You have to live in a particular service area in order to enroll in that particular Medicare Advantage plan at that premium. But the network is that you got to make sure that if you're part of a Medicare Advantage plan, the doctor that you see participates with that Medicare Advantage plan. That's what they mean by the network. Where remember with original Medicare, I told you that you can access any doctor in the United States. So that's really a big difference between option 1 and option 2 of accessing your Medicare benefits. These plans, the Medicare Advantage plans, will also set limits on how much you can pay out of pocket. This is a good thing. So if you happen to be part of a Medicare Advantage plan and you have a catastrophic year and you're multiple, you're paying co-payments left and right, and you're just paying all these different specialists, they're keeping track of what's coming out of your pocket. And essentially, if you hit that number, which is usually a high number, then for the remainder of the year, you're going to get all your Medicare services covered in full. Another thing too, Medicare Advantage plans will also throw in some extra benefits that you don't get if you stayed with original Medicare. And those extra benefits we're talking about, it could be vision allowances, dental allowance, over-the-counter allowances for over-the-counter medications. So there's different benefits that can be thrown in to sweeten that Medicare Advantage plan, things that you wouldn't get if you stayed with original Medicare. This next bullet that I'm talking about is that some plans offer out-of-network coverage. This is probably one of the most important things that you need to understand when you're looking at a Medicare Advantage plan, is that you want to make sure the type of plan that you're looking at. And by that I mean, is the type of plan an HMO POS, or a PPO plan? And I'm going to explain those acronyms, but that type of plan is really going to tell you how much flexibility you have to go outside of that network that I was talking about. So for example, if you're looking at a Medicare Advantage plan and the type of plan that they're offering you is an HMO, Health Maintenance Organization, that plan essentially is going to lock you into the network. So what that means to you is that you don't have the flexibility to go outside of the doctor. The doctor needs to participate in order for you to receive those services covered. But these plans do offer you out-of-network coverage, and those are in plans like HMO POS. An HMO POS, Health Maintenance Organization, point of service, that type of plan, again, it's an HMO, so for the most part, they're expecting you to stay and go to participating doctors. But when you see the POS attached to an HMO, it actually allows you some flexibility to go and see a non-participating doctor, although it's limited. And it's an annual limit that allows you a specific amount of times that you can go outside of the network. So for the most part, HMO POS, you're in the network, but you have some flexibility to go outside the network. When you're looking at a PPO, Preferred Provider Organization, and that's identified in your Medicare Advantage plan, those types of plans actually allow you more flexibility to go in and outside of the network. So you're not locked in. You can choose who you want to see, whether they participate or don't. Keep in mind, though, they may not participate with that company that you enrolled in, but that doctor also still needs to participate with Medicare, even if they don't participate with that company. Also keep in mind that although you have more flexibility with a PPO plan, you will pay more out of your pocket to see that non-participating provider. So you have the flexibility, but it's going to cost you more. Okay, so those are things to consider when you are shopping around and looking at a Medicare Advantage plan. So Other than that, now we're going to talk about the different times of the year that you can make changes. So you've got your Medicare A and B, you've made your selection as to whether or not you're an original Medicare with a supplemental plan, or you're looking at a Medicare Advantage plan. So now you want to find, well, when can I change my mind if my situation does change? When you're changing your mind is during the annual open enrollment period. That can occur right now, coming up October 15th through December 7th. This is the time of the year that you can evaluate what you picked this year and make a change. Whatever change you make prior to December 7th is going to take effect January 1st of 2023. This is the open enrollment period. Another time that you're going to be able to make a change is called the Medicare Advantage open enrollment, and that occurs January through March 31st. The first quarter of every year after your annual enrollment period, the first quarter of the year, you can, I kind of like to refer to it as your oops period, because any selection that you made during your annual enrollment period, if you change your mind about the Medicare Advantage plan that you selected, you can actually change to a different company, a different Medicare Advantage plan, or keep the same company and switch to a plan, another plan within that same company. You can even go back to original Medicare, your option 1. Okay, so it allows you the first quarter of the year to make another selection. Whatever time you make that selection, let's say you decide to make a change in February, that change will occur and kick in the first of the following month. The only thing that you cannot do if you go into your annual enrollment period with original Medicare and you did it in your annual enrollment, the first quarter of the year, you're not going to be able to make that change. It's only if you started off the year with a Medicare Advantage plan.
Okay, I'm going to just stop you for 2 seconds because we're at almost 11 o'clock. We're at 10:50. So I just want to check, does anybody have any questions? Because we do have a hard stop today because Zoom is being used.
Okay.
Anybody? I don't see anything in the chat. If you want to open up your mic and ask a question, now's the time to do it. Going, gone. Okay, go ahead and finish up your
Okay, I'm going to go as quickly as possible through the next slides. I just to make sure that everybody has the information.
I'm sorry, Oldine Collins had raised her hand. Oldine?
Thank you. Is it possible to get a handout of what you're of this presentation?
Yes, I can probably send it to Mart. Should I send it to you and then you can disseminate it, or you can send me an email?
Wait. Just send it to me. No, I don't want to start with millions of people sending you emails. Just send it to me and then we'll make sure that we get it posted. And also we're going to post also the presentation today, the video.
Thank you.
We'll do both. Okay.
Perfect. Okay.
I
So
have also a question.
Okay.
My question is, can you provide us with the phone number for Caitlin Farisi?
We'll go ahead and do that separately. Let's finish up the presentation. If there are any other questions, put them in the chat.
okay, so another period of time where you can make a change is called the special enrollment period. There are several reasons why you can make this change. Is if you qualify for low income subsidy. These are assistance programs available for people on Medicare. If you move out of the service area, if you lose your employer group. So there's different reasons why you would be able to have a special enrollment period. So the important thing is to know that you may qualify for something else outside of the annual enrollment period. If you're on Medicare, you're able to make appeals. If you disagree with a coverage or payment decision by Medicare, you always have the opportunity to make appeal. And once a claim is made, they'll send you in writing how you can make those appeals. When you're on Medicare, I'd also like to talk about some programs that are available to you to save additional money. One of those programs, I won't go into a lot of detail, is the New York State EPIC program. This is a state prescription drug plan that will supplement your Medicare Part D. You have to be eligible for EPIC. You have to be 65, income eligible, 75,000 single or 100,000 if you're married. But the bottom line I want you to know is that if you're eligible for Epic, it's a no-brainer. You should have it with your Medicare Part D drug plan in order to save more on your prescription drug coverage. I'm
And
just
we
gonna
are going to
skip.
have somebody coming in that's going to really be talking almost exclusively about Epic.
Yes, yes. So that's going to be it. You pay really, if you have an opportunity, listen in, because a lot of people don't realize that they may be eligible or how it can help them. Additional cost saving programs are what they call low income subsidy, extra help, Medicare savings program. Those are income based programs that if you qualify for it, that you may want to take advantage of it, because it's going to save you, it could save you the cost of your Part B premium. It could save you the cost of having to pay for your Part D drug plan premium, and also lower your co-payments. If you want to find more information about these, then by all means, you can call StateWide to find out. You want to know whether or not you're eligible for any of this low income subsidy, extra help, or Medicare savings program. If you are familiar with the Medicare savings program and you applied for it in 2022 or before that, and you were denied because you were just over the income levels, please keep in mind that in 2023, those income levels are going up quite a bit, and you may want to try again to see if you qualify for those extra benefits or extra assistance program. So I apologize if I went over the time. I know I gave you a lot of information, but that's why StateWide is here. Please feel free to reach out to us if you have any questions, or if you think you need any type of assistance. That's what we're here for. Again, my name is Candy Rivera Whitehead. I'm an outreach counselor that can be reached at that 1-800-333-4374 or email. So with that, I'll thank you for attending today's session.
Yeah, thank you so much. Any other questions? We did put some information in the chat, both about how to reach Caitlin. And we also will give everyone all this information in a whole bunch of different formats, and we'll put it in our newsletter. So you'll have everything you need. I see one new message. Oh, thank you so much from Aldine Collins. So thank you. And thank you, everyone. Have a good day. Thank you for getting here so early. Okay. Take care.
Thank you so much for the opportunity. Appreciate it.
Thank you so much.
Bye-bye, everybody.
Bye, everybody.